channel Bone Education.
Hello and welcome back to our channel Bone Education. Today I will talk about cases where during a bone density examination you receive two different diagnoses and how to proceed in such situations. But first, let me explain what accuracy and precision mean. Accuracy is when, for example, you shoot at a target and hit it right on. This means you were accurate. The same applies to osteodensitometry. The device is accurate if the diagnosis of osteoporosis, osteopenia, or normal bone density is correctly determined. Precision is not the same as accuracy. Precision is when you repeatedly hit the target. When it comes to osteodensitometry, this means that for the device to be precise, it should accurately diagnose osteoporosis, osteopenia, or normal bone density multiple times. Now that I've defined these concepts regarding osteodensitometry, we can ask the question: is the device accurate and precise if it shows normal bone density for your spine but osteoporosis for your hip? In such situation, there is a significant difference in the T-score between the spine and the hip. But what does it mean for the difference in T-scores to be significant? A large and significant difference in T-score occurs when, for example, the spine shows normal bone density while the hip shows osteoporosis. This typically happens if the difference in the two T-scores is greater than or equal to 2 standard deviations. This difference can indicate how accurate the osteodensitometer is. In this context, a study published last year examined the difference between the T-scores of the spine and hip using REMS and compared it to DEXA. This study found no cases of significant differences in T-scores in patients examined with REMS, unlike DEXA, where studies showed that 2 to 17% of people examined with DEXA have a difference in T-score between the spine and hip greater than 2 standard deviations. This indicates that REMS is more accurate method than DEXA, as the likelihood of errors related to artifacts, positioning, and software is minimized. Typically, when there is a difference in T-scores between the spine and hip, treatment is guided by the lower T-score. However, treatment is not determined 100% by the T-score, as the value of the T-score has different implications at different ages for treatment. Here you can see a table with T-score values and age distribution by patient gender. I have marked in red which T-scores at which ages indicate the need for therapy. You can see how the T-score required to start a therapy decreased with age. This means that the younger the patient, the worse the T-score needs to be to indicate therapy, and vice versa, the older the patient, the less severe the T-score needs to be for treatment consideration. Another point is that men enter the zone requiring therapy about 5 to 10 years later than women. In addition to the bone density examination, a history of accompanying diseases should be taken, as well as physical examination of the patient, and specific laboratory tests for the bones should be conducted. The approach to assessing treatment should be individualized and not solely based on the T-score. I hope you found this video helpful. If you enjoyed it, give us a thumb up and subscribe to our channel for more valuable content. See you soon.